How should I prepare for board exam? This is one of the common questions asked by any interns and residents. Today I will talk about my experience and the tips which helped me to pass the American Board of Internal Medicine examination. One of the viewer of my channel requested about this video, so I decided to share my experience with you today. First, I did not have that privilege to do the review course because of my financial situation, as I had to start the job immediately. So what I did, I know that I would have to face it. So from the very first day of my internship, I strive to read at least 5 to 10 minutes. I'm not a superwoman, so I could not read more than that. And definitely not all they are same. However, for majority of the day, I strive to read at least 5 to 10 minutes about the disease or about the case which I saw at the hospital. And my goal was to learn at least one teaching point from each patient. Remember that every patient is teaching you something. Doesn't matter how simple or how common their complaint is. Every patient should teach you at least one teaching point. Besides that, I always regularly attended all the morning reports, noon conferences, and grand rounds that definitely helped me to stay up to date with all the guidelines. Remember, if you are reading at least 5 to 10 minutes, if you are improving yourself at least 1% every day, after the year, you are 37 times more improved if you did not do that 1% every day. So never underestimate the power of taking small steps. Secondly, you do not have to know all the answers of these questions, meaning you do not need to have right answer for 100% of the questions. Target should be to have the right answer between 70 to 75% of questions. When I was preparing for the exam, I mainly focused only major portions. For example, the largest number of questions come from cardiovascular disease and GI. However, at the same time, make sure that you are not missing the easy, small topics or maybe like very straightforward questions. And remember, they will ask you all the questions which are at the level of internist. So you do not have to be super smart to pass this exam. However, you need to have at least between 70 to 75% of the questions getting right. Thirdly, here, one thing I want you to remember, that be vigilant about the question structure. For example, if they are mentioning about any particular geographical location, that geographical location may be pointing you toward any particular infectious disease. Another example is that if they are mentioning about occupation, try to see that is that occupation is suggesting to any particular disease. And maybe they are talking about medications, see that are they talking about any particular side effects. So always try to be smart with finding out the point which they are trying to give you from the question. There is a saying that when you are reading the question, try to understand the mind of the people who wrote that question. So try to find out that what is the main thing they are asking you here. And it is very important to be vigilant about the time management too. For example, for some people I talked, they told me that they're spending 2-3 minutes, maybe 5 minutes for one question. However, what happened, at the end of the block, they may do not have the time to answer maybe 5 questions. Do you think that is it helping them? Absolutely not. So if you are not sure about any questions, maybe mark them and move forward, finish it, and then come back to all your marked questions. Never ever keep any questions unanswered, because there is no negative marking. You must have to take the chance. If you are not answering any question, it's already gone. So never ever keep any questions unanswered. And one point here is that if you are guessing any answer and you already choose it, do not change your first guess. Because research has been showed that our first guess during the exam situation is mostly right than the second or third one. Unless you are 100% confident, okay, so no, my first guess is not right, this is the right one, change it. However, do not just change it at the very close to the end of the block, because the research has been shown that it could be wrong answer. Finally, here I would like to share some thoughts and experience regarding the exam day. First, sleep well the night before the exam. I know it's very easy to say because we are human beings, that this is a stressful situation because long day is waiting for you. However, calm down your mind, because you need that rest to give the 100% attention for your exam. Secondly, utilize the break time. If you are saving your break time, it's not helping you. So why should you do that? So utilize the 100% break time, utilize the break time to go to restroom and have some nutritious food during the exam day. And one more thing here, I must have to say that all of us are victim of this, that do not think about your previous block during the break time, because break time purpose is to give yourself some rest so that you can think logically for the next block. If you are wondering upon the, okay, maybe that was not right, or maybe I should choose that answer, that will not definitely help you. So if you made anything wrong, forget about it and then tell yourself, I still have time. My target is between 70 to 75%, not 100%. So let's focus on the next blocks. And very important thing to remember, that board will never ever ask you any controversial topics. So when you are reviewing the guideline, read about the class 1 recommendation, 2A and 3. You do not need to worry about 2B, because there is very less chance that they will ask about it. Always remember, no controversial topics will be questioned in this board examination. None of us will be ever fully prepared for this exam, because medicine is vast, is always evolving. So stay calm, prepare, and utilize all the time, at least few minutes every day, and then go to the exam, because as nobody will be 100% prepared for this exam. I'm glad that I do not have to take this exam in next couple of years. Thanks to Almighty for that. And I hope that you will find these tips and my experience helpful for your preparation. And if you have any particular tips that you find helpful and want to share with the viewers, please put it in the comment section. And if you have any questions, any comments, please put it in the comment section as well. I always make sure to read them very attentively and reply to that as well. If you want me to make any video on any particular topics, please reach out to me as well. I wish you all the best and best wishes for your exam. Take care.